Monkeypox is a viral infection rarely seen outside Central and West Africa. But in May 2022, scores of cases were detected in Europe and North America.
This is a big deal, and it's going to be a big deal for a while. You know, the fact that these cases are showing up over very wide, geographic distribution is really concerning. It suggests that this has been spreading for a while undetected.
The disease causes flu-like symptoms like headache, fever, and chills. Within days, patients develop a distinctive rash with lesions that can form on many parts of the body. These painful lesions are the hallmark of the disease and can cause scarring. Monkeypox can be fatal, though the strain responsible for this outbreak typically causes mild disease. According to the Centers for Disease Control and Prevention, the virus can be spread through direct contact, contaminated objects, and respiratory droplets. Despite its name, the virus does not come from monkeys. It's closely related to smallpox, which was eradicated in 1980. Scientists have not been able to pinpoint its origins to one particular animal, though African rodents may play a role in its transmission. There are antiviral drugs and vaccines developed for smallpox that can be used against monkeypox.
Meanwhile, health officials are tracking the spread of monkeypox around the world. The virus, typically found in West and Central Africa, is now suspected of spreading to 16 countries, including here in the U.S. There is some better news as it relates to monkeypox. Henry Ford Health Assistant Medical Director for Infection Prevention, Dr. Dennis Cunningham, telling us the virus is not transmitted as easy as COVID, certainly not as much as smallpox, but they are in the same viral family. He says in order to get monkeypox, you have to have the virus go through your skin from an animal bite, or it has to go through broken skin or mucous membranes like eyes, nose, mouth, and particularly genital tract.
It looks like this is really being spread sexually, which means it's not going to be running rampant throughout our populations. It is a concern. The good news is most people who get it are not even going to have symptoms. If you do get symptoms, people tend to have a mild course of illness.
Dr. Cunningham went on to say if you do end up getting monkeypox and you have a compromised immune system, there are medications available for treatment. The CDC is also planning to release its vaccine that combats both monkeypox and smallpox. We'll, of course, keep you updated as we learn more about this virus. Dave.
What you need to know about the rare outbreak.
Yeah, David, President Biden wants everyone to be aware of monkeypox as the cases of it continue to climb. He says the threat doesn't rise to the level of COVID-19, and he doesn't see the need for strict quarantine rules like we had during the early stages of the pandemic. Florida health officials are investigating a presumptive third monkeypox case in the U.S. The virus spreads from one person to another through respiratory droplets and contaminated materials. It can enter the body through broken skin, the eyes, nose, and mouth. The symptoms include a fever, swollen lymph nodes, and lesions.
We know how to treat this if people get really seriously ill. For example, we have an antiviral that has activity. We have, antibodies that can be deployed if needed. Number three, we have a vaccine that we can use in the general population.
And the fatality risk from monkeypox is low. People usually recover within 2 to 4 weeks without needing to be hospitalized. President Biden says he thinks the U.S. has enough stockpile of the vaccine to handle the spread. David.
All right, Brian, thank you. The World Health Organization urges people to help prevent spreading the virus. You're asked to isolate if you have symptoms. It also advises people to wear a mask if you come in contact with an infected person and to thoroughly wash your hands and surfaces.